Hello and welcome to the 2026 open enrollment period for the State of Wisconsin Employee Trust Fund Group. I am Megan Umness, a large group account manager with Aspirus Health Plan. So you are joining this session where we're going to talk specifically about Aspirus Health Plan and the networks to help determine if this is by chance the plan that might work best for you and your family. Before we dive in, I'd just like to share a little bit about myself. I have been a licensed insurance agent in Wisconsin since 2008. I have worked for a couple of different health insurance companies, varying in roles such as customer service, self-funded plan administration, and most recently, over the last about 9 years, I have been in the account management role. Outside of my job, I am mom to 3 boys, ages 11, 9, and 6. So as you can imagine, my house is always bustling. And just something that I kind of like to share is how working in the healthcare field has really, kind of changed my outlook on taking care of myself and taking charge of my health. And I like to encourage others to do the same. I work with some really great people who we've all kind of aligned in our mission, and we put our health at the forefront every day. So I encourage everyone to look into doing the same. But back to, the topic at hand here today is talking about health insurance. So if you decide to enroll with the Aspirus Health Plan, you would be enrolling with our signature network. What does that mean for you? Well, that means that all of the Aspirus clinics and hospitals within Wisconsin would be considered in-network for you and any of your covered family members. We have a list here on the screen of all of those hospital locations in Wisconsin, as well as a map that shows you kind of primarily where we're located, and each of those green dots is a hospital location. So as you can see, our service area really centers around the northern and central part of Wisconsin. Beyond just the northern and central part of Wisconsin, however, we do have 3 hospitals in the Upper Peninsula of Michigan. So if you find yourself traveling to that area, possibly living in that area, and you would like to access those hospitals, they are included as part of the signature network and available to you. Additionally, though, I like to put this message out there because sometimes people think just because we're Aspirus Health Plan, you are going to be limited to only Aspirus clinics and hospitals. That, however, is not the case. As you'll see here, it is quite a robust network and includes some major health systems outside of just Aspirus. Some of those major health systems include Aurora Healthcare, Bellin Health, Children's Hospital of Wisconsin, Gunderson Health System, Reedsburg Area Medical Center, Theta Care, and UW Health. Aspirus Health Plan is considered a full-service plan for the counties of Forest, Langlade, Lincoln, Marathon, Oneida, Portage, Shawano, Taylor, Vilas, Waushara, and Wood. We are considered a limited service plan for Clark, Florence, Iron, and Price. Should you have questions about whether or not your particular doctor is in network, so maybe they're not an Aspirus doctor, maybe you have a chiropractor or an orthodontist or an optometrist that you see, you can certainly check our online provider directory to confirm that they are in network. Very easy to do by visiting our website. You'll navigate to the provider, find a doctor, select the Wisconsin ETF Employee Group Signature Network from the drop-down, and then a window will appear. You'll need to click Begin Search, and that will proceed forward. Once you're there, you can determine if you want to search for a specific doctor, a clinic by the name, or if you don't have a doctor in mind, you can enter in your zip code and a range, and it'll return everybody within that radius for you. As always, though, you are welcome to call our customer service team and ask them questions about the network. Or one other option, on the Find a Doctor page 2, on the left-hand side, you will see a full PDF provider directory, which is hundreds and hundreds of pages. You can click on that, though, and do a search by using your Control F. So if you have a specific doctor's last name, feel free to type that in and search throughout the document. I sometimes find that to be handy if I don't want to plug in zip code information or just kind of want to see everything that there is to see in one place. We do have some online resources for you as you are out here making your decisions. you can navigate to our dedicated ETF webpage, which we have posted here. This is what it will look like when you land on that page. Please note you do not need to enter a username and password in order to access the general information. So the Find a Doctor, the View Benefits, and the Check Prescriptions, you're not required to enter any information in to access those pages. The Check Prescriptions will redirect you to the Navitus website, as they are the pharmacy benefit manager that ETF uses to administer that portion of your medical benefit. If you click on View Benefits, you'll be able to see the 2026 summaries of benefits and coverage. And then if you click on the Find a Doctor, it will redirect you to the network pages where you can do those searches we just talked about. Once you have enrolled with Aspirus Health Plan and your eligibility start date has come, you can then register online for the member portal. I encourage everyone to set up a member portal. This allows you access to do things like view your explanations of benefits, check where you are at towards your deductible and out of pocket, request additional ID cards, just monitor your claims progress, whatever it happens to be. As I do like to remind everyone, however, if you have dependents, children that are over the age of 18 or a spouse, they do need to set up their own username and password due to the HIPAA privacy laws. That is a requirement that be done in separate. If you are not already in the Aspirus Health system, but you are looking to establish with a doctor and transfer your care over, we do have the Aspirus Welcome Center available to you. I highly encourage everybody, to go this route if you are not sure where to start. I went through this myself. It was seamless, very easy. These nurses can assist you with transferring medical records in from other provider systems. They can help you select a primary care provider, and they can also help you set up an appointment with your new primary care provider. And just for awareness, they are registered nurses who are also patient-facing. So if they do not answer when you call, just leave a message and they will return your call once they are done taking care of all the other things that they are constantly doing. One of the services available as an Aspirus Health Plan member is the access to the 24/7 nurse line. We partner with a company called Vital Work Life to provide these services to our members. This is a free service with no cost to you. It's available 24 hours a day, 7 days a week. No limitations on how many times you can utilize the service. The representatives are registered nurses, and they do screen the calls to place priority to the urgent calls. I recommend this as kind of a triage if you're not sure if you need to be going into the urgent care or maybe the emergency room, or if you just even have a general health question that you could bounce off of the nurse. This is kind of a good first step to kind of vet that out and get some direction instead of trying to kind of troubleshoot it on your own. In addition, but yet separate to the nurse line, we offer a product called MD Lives. This is your telemedicine service. These are going to connect you to board certified doctors. You can access them by phone, by secure video through your computer, or they do have a mobile app, which I recommend downloading and having everything entered into prior to even needing to use it. So when the day comes that you need it, you're not urgently trying to rifle through and put all of your information in it. There are costs associated with MD Live, and they are dependent, of course, upon which plan you enroll in through ETF. So check your summaries of benefits and your schedules of benefits within some of your open enrollment materials to determine how those claims are processed and what kind of responsibility you would have. But some unique items about MD Live is that they go above and beyond just general health concerns and offer behavioral health services as well. So they have counseling available as well as psychiatry. And then in a different area, they also offer dermatology services. And I highlight these areas because there tends to be a need for these services that isn't always being fulfilled fast enough by your traditional healthcare systems. Appointment times can often be weeks or even months out to see some of these specialists. So knowing that MD Live is available and you are going to be seen much quicker should you need it is just a very good option and something to keep in the back of your mind should you need it. The information for MD Live is available here for you. And both MD Live and the Nurse Line, we do print the information on your ID cards as well, so it's always handy. Just to touch on a service that ETF makes available to their employees is advanced care planning. We support ETF in recognizing the importance of advanced care planning, and this is having documentation of what your wishes are should you be unable to speak or communicate what those are to your family members. This way you can rest assured that your medical care is handled as you would have liked it to be handled. It's not something we want to think about, but it does happen. And so we encourage you, along with ETF, to make sure that you have all of the correct documents in place to prevent an outcome that you would not want to have happen. Just a couple of quick reminders. There is no out-of-network coverage under the Aspirus health plan, except in the situations of urgent or emergent care. So you do have to use in-network providers. You will receive new ID cards prior to January 1st. So if you are already enrolled in Aspirus health plan, expect to receive a new ID card. If you are new to Aspirus health plan, definitely you will be receiving a new ID card. Make sure you're using that new card January 1st, 2026 and beyond to prevent any delays in the processing of your and your family's claims. If you need additional cards, you can request them online through the member portal, or you can definitely call customer service and ask for additional ID cards. Open enrollment closes on October 31st of 2025. Any of your elections will go into effect on January 1st of 2026. So make sure you are submitting everything prior to that deadline. Don't forget that the ETF website has lots of great resources available to you. Lots of your questions can be answered out there for your general health insurance questions, plan design questions, what options are available to you as far as health plans. They do a phenomenal job of putting so much great information out there for everyone so they can access it when it's convenient for you. Additionally, they partner with WebMD to provide the Well Wisconsin program. These are no-cost resources that are available to their employees. And they include things such as health coaching, chronic condition management, a diabetes program. Be sure to tool around out there. The information is linked here for you. Again, great information, a great program to help try and keep employees and their covered dependents healthy and navigating this complex world of healthcare and health and wellness, really. And I touched on this before, but just always a great reminder that your prescription benefits are administered through Navitus Health Solutions. They are the pharmacy benefit manager that ETF has partnered with to provide this benefit. So should you have any questions about coverage for your prescriptions, network pharmacies, co-pays, which prescriptions are covered, which are not, are there any requirements to receive certain prescriptions? You will want to direct all of those questions to Navitus Health Solutions, and they will be able to assist you with any of those questions as you are meandering through the health insurance world. And I thank you for joining me today. We definitely look forward to the opportunity to serve you. And if you are already a Aspirus Health Plan member, we appreciate that you've chosen us as your health insurance carrier. And we just look forward to continuing to work with you. Thank you.